I call this meeting to order. Welcome to meeting number 38 of the House of Commons Standing Committee on Health. Today we meet for clause-by-clause consideration of Bill C-31, an act respecting cost of living relief measures related to dental care and rental housing.
With respect to this, I know it's very loud right now. Hopefully our colleagues can hear this, and those in the gallery. We only just heard some of the testimony on the fee guide, and I for one have some concerns regarding, as I stated to the officials, regarding the fee guide and how we ensure that dental care remains affordable, and that that the benefit actually will be applied to. I guess the question I'm asking is, if we had an amendment towards the fee guide, is there a mechanism in place for us right now here currently tonight that we could have somebody help us draft an amendment?
Yes, and they're here.
Okay.
Mr. Mella, Philip Mella, and Marie-Hélène Sauvé are from our legislative clerks that are here to help us. It is permissible to bring forward an amendment for which there has not been given notice, but once we get to 12 o'clock, we will be going straight to a vote on only those for which notice has been given. So if there is an amendment proposed for which there is no notice given, which is what you were contemplating, you are welcome to do that. It will have to be done in writing in both official languages, and it will have to be dispensed with before midnight, or it effectively falls off the table.
It's just, I mean, perhaps, I've been a member of Parliament for 7 years now. This is the first time I've ever seen a bill or a piece of legislation where the amendments had to be in before we even seen the witnesses. And we saw 2 ministers on this. We studied this bill for literally 2 hours on something that is $10 billion. And really, the ministers really, well, I appreciate that there's a lot of moving pieces to this. They really weren't able to answer some of the questions that, Minister Hussain said, if the Conservatives would stop, we would just get out of the way, essentially. Well, we're doing our job. It's $10 billion that is projected to be spent. We want to ensure that it's A, getting to the people that require it, B, that there are measures in place that all of a sudden the industry doesn't increase their fee guide and making it unattainable again. So I guess there's just questions and concerns, but you're saying now that if we do draft an amendment, it won't be able to be voted on anyways.
It will be able to be voted on, provided that vote happens before midnight.
Before midnight. Okay, great. Thank you. Okay, thank you.
Ms. Sauvé has some additional information. Mr. Doherty, go ahead.
I just, on a point of clarification, we can advise here as legislative clerks on the admissibility of an amendment that is brought forward from the floor and that's not currently included in the package. However, we cannot assist with drafting it. That would be the work of the Legislative Council.
Okay, so there is no mechanism in place to have it done tonight before midnight. It would have to be translated. And so essentially, what you have is what you get, is what you were saying. All right.
Today's meeting is taking place in a hybrid format pursuant to the House Order of June 23rd, 2022. I would now like to welcome the officials who are with us this evening, and we are well supported with plenty of expertise around the table. We have from the Canada Mortgage and Housing Corporation, Ms. Nadine LeBlanc, Senior Vice President Policy, Ms. Patricia Rosette Zupa, Vice President Policy Development, Ms. Louise Michel, Director of Legal Services. From the Canada Revenue Agency, Ms. Gillian Pranke. I'm sorry if I've mispronounced that name. Assistant Commissioner, Assessment, Benefit, and Service Branch, and Ms. Heather Daniels, Director General, Benefit Programs Directorate, Assessment and Benefit Services Branch. And from Health Canada, Ms. Lynn Thompson, Associate Assistant Deputy Minister, Strategic Policy Branch. And as you just heard, we also have with us the legislative clerks, Marie-Hélène Sauvé and Philippe Mella. So the good folks at the back of the room should be able to handle any technical questions you have with respect to the substance of the bill or the amendments. The good folks at the front of the room will be able to handle your legal and technical questions on that end. We are going to now move, but there'll be no opening statements. Everyone you see here is a resource to help us do our work. We're now going to move to clause-by-clause consideration of C31, but I have I have a bit of a script here for you. As the name indicates, this is an examination of all the clauses in the order in which they appear in the bill. I will call each clause successively, and until midnight tonight, each clause is subject to debate and a vote. If there are amendments to the clause in question, I will recognize the member proposing it, who may explain it. The amendment will then be open for debate. When no further members wish to intervene, the amendment will be voted on. Amendments will be considered in the order in which they appear in the bill and in the package each member received from the clerk. Members should note that amendments must be submitted in writing to the clerk of the committee. The chair will go slowly to allow all members to follow the proceedings properly. Amendments have been given an alphanumeric number in the top right corner to indicate which party submitted them. There's no need for a seconder to move an amendment. Once moved, you will need unanimous consent to withdraw it. During debate on an amendment, members are permitted to move sub-amendments. These sub-amendments must be submitted in writing. They do not require the approval of the mover of the amendment. Only one sub-amendment may be considered at a time, and that sub-amendment cannot be amended. When a sub-amendment is moved to an amendment, it is voted on first, then another sub-amendment may be moved, or the committee may consider the main amendment and vote on it. Once every clause has been voted on, the committee will vote on the short title, and the bill itself, and in order to reprint the bill may be required if amendments are adopted so that the House has a proper copy for use at report stage. Finally, the committee will have to order the chair to report the bill to the House. That report contains only the text of any adopted amendments as well as an indication of any deleted clauses. So, so we're now proceeding with clause-by-clause consideration pursuant to Standing Order 75 sub 1, consideration of clause 1. The short title is postponed, and I therefore call clause 2. And I understand that there is an amendment proposed to clause 2. Monsieur Garand, do you wish to introduce the amendment?
Oui, merci. Yes, thank you, Mr. Chair. Of course, the Bloc Québécois is presenting that the preamble be modified. There is a mention at line 2 and 3 while drawing up a national long-term dental care plan. We know, Mr. Chair, that many provinces feel, and Quebec as well feels, that this is excessive involvement in Quebec jurisdiction.
Mr. Chair, I thought we moved past the short title, and we moved to clause 2, which would be the block amendment, clause 2. Mm-hmm. Correct? Mm-hmm. That's what I'm asking. I guess that's where we're asking. Okay, sorry. I thought you were talking about the short. Okay.
Évidemment, ici on travaille. Here we are working on a plan, which is justified by the power of the federal government to spend money, which once again is due to the fact that Ottawa has a lot of money, much more money than what the provinces have to deal with their own needs, which is certainly the case in Quebec. We already have a plan in Quebec that covers children under the age of 10 and younger. And this, to some extent, had to be modified due to lack of funding, in particular federal funding. So it's important to see the context. Ottawa is in part responsible for the fact that this universal program of ours is not as generous as it has been in the past. So, with regard to this bill, once again, this has to do with the federal government's ability to spend money. We'll discuss the rest later on. But right now, about spending money, we are working up a dental care plan, not necessarily support to families for care. And therefore, we find that this is overstepping and over-involvement in provincial competence, and indeed has a negative effect on the relationship between the province of Quebec and its federal government, such that this has a negative effect on the drawing up of programs, or program, plural probably, that will be able to truly help children obtain dental care. So, of course, this is still, to some extent, the preamble. The substance of the bill is not at issue specifically, but this section of that sentence, at least, should never have appeared as it does. So I think that within the preamble, if we take out lines 2 and 3, as the Bloc Québécois has already moved, then we are in a better position to give a correct description of this bill. It's more about really defining what the bill is restricted to, and will avoid political excesses, not allowing the government to take action which should not be allowed for. So it would be appropriate to withdraw it from C31. And it would be respectful toward Quebec to withdraw it, this section. Nor does it prevent, and I say this with due respect to all colleagues, nor does it prevent the federal government from, in the weeks and months to come, from sitting down with Quebec, sitting down with the provinces to draw up a way to support dental care plans or rights to withdraw from federal plans with full financial compensation. So those two lines really should not be in this bill. It's not a proper description of what's at issue, and I suggest that we take them out.
Next, Ms. Sidhu, and then Mr. Davies.
Thank you, Mr. Chair. Mr. Chair, we need a national dental plan that covers everyone, and that this bill is the first step. And the proposed amendment would remove key context from the preamble. Mr. Chair, I just want to say when I asked the question to Minister, and then answer work on the long-term national dental care program is ongoing. We need a national dental plan that covers everyone, and this bill is addressing that. So I would oppose to this amendment, Mr. Chair.
Ms. Sidhu, Mr. Davies, and then Ms. Goodrich.
Thank you, Mr. Chair. Well, I have a couple of practical reasons to respectfully oppose this amendment, and some broader constitutional ones. On a practical level, what I think a preamble and what legislation should do is it should describe in very plain language and in very accurate language to the people who elect us what exactly the laws that they're expected to comply with say. I know that my Conservative colleagues, I think Mr. Poilievre made it a strong feature of his recent leadership campaign to speak in plain language. And in terms of an accurate description, the reason that these words not only should be in the bill but must be in the bill is because they describe accurately to Canadians what exactly this legislation is doing. I think anybody on the Health Committee who's been following social media will see that there's an immense amount of confusion about what this bill does. I've seen people on Twitter and on Facebook say this bill is not a dental care plan. And they attack this legislation on the basis that what was politically pledged to Canadians that we would provide them with a dental care plan, and this legislation is not that. Well, they're right. This legislation is not a dental care plan because it's not designed to be a dental care plan. This legislation is designed to be an interim bridge benefit to pay money to parents of children under 12 while we work on the permanent national dental care plan. And that's exactly what this says. Were we to take these words out, Mr. Chair, we would be actually doing a disservice to Canadians by not describing to them exactly what this is. If we just said that we recognize the need to provide interim dental benefits for children under 12 years and stop there, without telling them that we're working towards the development of a long-term national dental care program, that would be inaccurate because we are working towards the national dental care plan. Now, I respect my colleague from the Bloc Québécois' position on the constitutionality and the considerations that go into work with the provinces, and we can certainly have that discussion on a different day. But that's not a discussion for this legislation tonight, because this legislation simply sets out what is going on, which is we are dealing with legislation that would establish the interim bridge payment to raise issues over the permanent dental care plan and whether things constitutional. While I'm on that subject, though, I must say I've made it my mission in life, anytime anybody questions the constitutionality of the federal government's role in health care, to have a robust defense. My friend brought up the spending power. Constitutionally, the term spending power has come to mean the power of the federal government to make payments to people, institutions, or governments for purposes on which it does not necessarily have the power to legislate. The constitutional validity of federal spending in the area of health was confirmed by the Supreme Court of Canada in its 1991 decision in reference re Canada Assistance Plan. The Supreme Court of Canada held that the establishment of the Canada Assistance Plan was valid action, and they stated that federal spending power is wider than the field of federal legislative competence. According to Canadian constitutional expert Peter Hogg, he said this, and I think this describes the state of law in the most pithy way. The federal parliament may spend or lend its funds to any government or institution or individual it chooses, for any purpose it chooses, and that it may attach to any grant or loan any conditions it chooses, including conditions it could not directly legislate. There is a distinction, in my view, between compulsory regulation, which can obviously be accomplished only by legislation enacted within the limits of legislative power, and spending or lending or contracting, which either imposes no obligations on the recipient or obligations which are voluntarily assumed by the recipient. So in other words, if the federal government is using its spending power to give money to an individual and imposing no obligations or conditions whatsoever on the recipient, the federal government is free to do so. It's only when they attempt to impose obligations or conditions on a province, on a territory, on an individual, that it has to act within its legislative ambit. Recent federal benefit payments to individuals in using its power, the Universal Child Care Benefit, the Canada Child Benefit, the Canada Disability Benefit, the Canada Emergency Response Benefit, CERB. Now, you may know that, and be interested perhaps in Mr. Guérin's view on this. When the federal government recently used its spending power on CERB, very similar, in fact, I would say, argue identically to what's happening in this bill. What's that? The federal government sees a crushing need, and they respond by developing a federal program, and they say to Canadians, you can apply directly to the federal government for money. And they do, and the federal government spends that money. I didn't hear any opt-out argument from Quebec or anybody else. There was no question of constitutional jurisdiction there. There was not a peep. Why? Because that's as it should be. Because that's the federal government doing what it should do. And I'm going to conclude just by saying dental care is primary health care. It's not a luxury. It's not an option. It's not secondary to health care. Ms. Goodrich has given this committee some very powerful words when she described the pain her child was in as the child was teething and they couldn't get access to Tylenol for children. Imagine right now, as we speak right now, there are parents in this country with children who are 5 or 7 or 9 or 11 who are crying because they have dental pain and they can't afford to go to the dentist. And this legislation would, in a very quick way, get money out the door, $1,300 per child, in the next 12 months. And we'll, if necessary, we can talk about what that would buy, but we know it would buy a checkup at the dentist, it'll buy an exam, it'll buy a set of x-rays, it'll buy a cleaning, and it'll buy multiple fillings. That's what $1,300 buys. And we can have that money out the door as early as December. And so in terms of working towards a national plan, this legislation simply describes to Canadians what the intention and the actions of this Parliament are. And where I'll conclude is, by removing these words, we would be actually confusing and misleading Canadians as opposed to telling them what this government is doing. And I say what we're doing is probably the single biggest expansion of public health care in this country in half a century. And I'm proud of that.
Thank you, Mr. Davies. Ms. Goodrich, please.
Thank you, Mr. Chair, and thank you, Mr. Davies, for that in-depth conversation on your assessment of the division of powers and how that kind of comes down. But it's not necessarily pertinent to this particular piece. And a long time ago, my dad, when I asked him how he voted, he told me that he always voted for the politician with the shortest speech. So I've always tried to keep that in mind. And my question on this particular amendment is quite simple. It's not the same in English versus French. Why?
Sure, it's simply a feature of how the French and English in the bill itself don't necessarily line up. But what it does in effect when reading the French and the English, it amounts to the same result.
Monsieur Garand.
Mr. Chair, it's always wonderful to have an NDP member teach me about the existence recognized in some courts, about the existence of a gap recognized by many courts in the Constitution regarding Quebec. And the Quebecers will understand what I'm referring to and recognize that this is the case. So while I'm getting this little legal instruction, I haven't been listened to. What we're saying is that this bill is based on the federal government's ability to spend, and this is therefore going as far as the federal government can go in spending, even though this is very unpleasant to us, and that this is what the bill covers, really. And perhaps my NDP colleague might have listened to me, and then he would know that he agrees with me. So here's my point. The two lines that we are asking to have removed are not lines that have legislative purpose. They are two lines that have a political and thus speculative purpose. Mr. Chair, we know that the aim of this bill is to support the agreement between the Liberal Party and the NDP to guarantee that they maintain their majority in the House, which is directly contrary to the mandate that was given us by electors last year, Mr. Chair. But I'm concerned that as of today, every bill that we will be studying in committee, every bill that we'll be studying in the House, Mr. Chair, will include lines about the NDP's political platform and intentions for the next year and so on and so forth in order to support the government and keep it alive. These are political lines of a speculative nature, of a political nature, and that's why they should not be in this bill. So I think my colleagues should keep that in mind.
Overton, please.
I will apologize to my colleagues again. As I'm new to the committee, I still have a lot of questions with respect to the bill. And I will go again on record saying I can't believe that we are moving forward so quickly with a piece of legislation that's going to commit at minimum $10 billion. And I appreciate our colleague, Mr. Davies, saying it's not a plan, because it isn't a plan. But the question I have is more of a technical aspect, Mr. Chair, to our witnesses that are here. I can't remember the testimony, forgive me for that, from the minister, even though it was the minister's. It was just an hour ago. Are First Nations children eligible, First Nations families eligible for this benefit?
Yes, they yes, they would, as long as they meet the eligibility criteria. So they are covered by NIHB, but if there are expenses for which they are not covered under that program, which would be or could be unlikely, but if it was to happen and they do meet all the other criteria, they could receive this benefit.
Okay, so then it goes back to my earlier comment regarding the fee schedule. Many First Nations live in rural and remote areas where dental care, the cost is fairly high, and it is an incredible barrier for seeking that. So just for point of clarification, there is stacking allowed with this for First Nations families, correct? From what they're getting from the NHIB, and they can top up with this benefit.
As long if they have out-of-pocket expenses for which they would have a receipt, they can, again, as long as they have the other benefits, they can. Okay. But this is similar to others that would have access to.
So they don't have to have I'm sorry to cut you off, I'm sorry. But they don't have to have they don't do an attestation, they just have to have the receipt from what they.
Well, they would still have to do an attestation. Okay. They would still need to, there's the income threshold, then there's the age of the child. There's all the other things. They have to give us the name of the
dental provider.
Exactly,
dental
and not.
Okay, thank you.
Mr. Van Couverton.
Thank you, Mr. Chair. Just compelled to speak up on the kind of direction of this conversation a little bit. Specifically, Monsieur Garand, and the sort of conversation around the government's ability, federal government's ability to spending power. I would challenge the word ability. Of course, the federal government has that ability. They also have the requirement, the obligation to support all Canadians, not just one province. And I would just say that I'm an MP from Ontario, but I care about provinces that don't have a dental care provision. I care about ones that do have a dental care provision, whether they're in Nunavut or Northwest Territories or British Columbia. And I was elected to support Canadians from every province and territory. I'm not challenging any of your arguments, but I think that using the word ability, I think of it as an obligation to spend money across this country and ensure that we're reducing inequality. Just secondly, the number 10 billion has been thrown around a lot, and just most recently the number was at a minimum 10 billion, and I don't think those numbers are correct. I think it's quite a lot less, and I think it's actually a maximum of 10 billion over a long period of time, which includes a future and ambiguous at this stage dental care bill. But I'm going to look more into those numbers a little bit. And in addition to all of that, the main reason why I'm extremely supportive of this bill is because it is going to support Canadians in really tough financial situations right now, and it's going to ensure that they can go and visit the dentist when that might be a tough decision. It's expensive to visit the dentist, and they shouldn't have to choose between, we've heard members from other parties talking about having to choose between essentials like rent or food, and dental care is an essential, and this will remove that from that equation. And just finally, every party in the House right now, we know it's a minority government, minority parliament. We all have an opportunity to contribute. And precisely 0 people that I talked to during the last campaign would say that they didn't want us to work together. We have an opportunity to work together, and we have an obligation to work together. So to continually suggest that this bill is just to keep the government alive or something like that, like, it's disingenuous. Canadians don't care about our partisan crap. They want us to get on with it and create programs that support them. This is an example of that, and I look forward. There's other examples of that. Mr. Doherty, I know you're up next. You have a good idea. You've contributed a lot to the conversation around mental health and suicide prevention, and we work on that together, and I'm thrilled that we do. And this is just one of those opportunities to work together, better outcomes for Canadians.
Dr. Ellis, please.
Thank you, Chair. Interesting enough, my colleague mentions working together. It's interesting there's a guillotine clause in this bill, and obviously we need to be here till midnight debating this without any significant number of witnesses from many, many stakeholders, which appears to be unusual in how we work together. So from that perspective, it doesn't really make a whole lot of sense. But anyway, that being said, I had a question for the witnesses who actually are here, and I think I think we heard about specifically about the NIHB situation. So if a family fits all the other criteria and they were having a copay from their private plan, could they use the money to pay for that?
As long as they have that receipt for which they have out-of-pocket expenses, they could apply for this benefit.
So that's a yes.
If they used it for the dental services, yes.
Great. That's all I have, sir. Thank you.
Please.
Thank you, Mr. Chair. So I just want to clarify, I'm just really digging in here. So Clause 7B4 states very clearly who is not insured under a dental service plan and who does not have access to dental care insurance plans obtained on the basis of the employment of the applicant, their cohabitating spouse or common law partner, or any other person. So I'm curious how that matches up with the answer you just gave to my colleague from North Cumberland, Colchester, because it states very clearly in black and white in this bill that they cannot apply for this if they have other insurance. So if the intent of the bill is such to allow people to have the top up, then I believe that would probably require some major amendments. But as the bill is currently written, unless I am out to lunch and perhaps our legislative clerks can assist us in this, I believe that the bill stipulates that answer is incorrect.
Okay, just before you do, I'd like to provide some guidance here. We are now debating an amendment to Clause 2, and the question that you're being asked to answer is in connection with Clause 7. So in fairness, we've gone a bit away from where we should be, but she's asked the question. I would ask you to answer it, but I raise that as a note of caution for everyone here. We will get to Clause 7. Go ahead.
Mr. Chair, the first question was as long as all the eligibility criteria were met. So if you do have, you're absolutely right. If you do have private insurance, you are not eligible for this benefit. But if you do have out-of-pocket expenses for which you have a receipt and you met all the criteria included, you are right. Private insurance, if you have private insurance, you cannot apply for this benefit. But if you have out-of-pocket expenses for which you are not reimbursed, you could apply.
I'm still confused, and I guess this is something that we'll get to when we get to Clause 7.
Actually, Ms. Goodridge, my bad. What you cited, you said it was Clause 7. It was actually subsection 7 within Clause 2. You're entirely within your rights, and I shouldn't have provided the guidance or intervened or interrupted or anything of the sort. You're absolutely on point, and you should go right ahead.
Sorry. I thought I was right, and then I got confused and got very nervous. I think it just points a few things out, but The part that gets me concerned is when we look at the program that's in place for First Nations kids specifically, many of these kids have to travel long distances in order to be able to see the dentist. In my riding, if a kid lives in Janvier, they're either traveling 150 kilometers each way to get to Fort McMurray or a few hundred kilometers to get to Lac La Biche. And so while they are covered under insurance for the cost of the procedure, there are a lot of out-of-pocket costs to be able to attend this. And so I'm very confused as to whether those kinds of out-of-pocket costs for mileage would count for large rural ridings like myself or what Mr. Hanley has, where a large number of people would have to travel in order to be able to get these services, or is it just for the service itself? I think there's some importance in having some of this clarification because this will benefit potentially families in my riding depending on how the answer comes out.
So there is a definition about dental care services and what that encompasses. It does not encompass mileage, for example, that you used in your example. It is really meant for the services that a dentist, for children probably less likely, but a denturist or dental hygienist is lawfully entitled to provide. And it then goes on to explain it could be for oral surgery, diagnostic, preventative, restorative, endodontic, periodontal, prosthetics, orthodontic services.
I'm still confused, but I think we're going to have to move on.
Mr. Shields, please.
Thank you, Mr. Chair. Going back to the original amendment that we have, so just for clarification with the sponsor of that first amendment, are we talking about this is an aspirational statement that you see being added on, and this isn't an aspirational document, this is a legislation, a bill, and this is not where an aspirational statement should be, because that's not what the bill is. I'm assuming that's what you're talking about. So all of the conversations that are going on, you would like to see a statement ended where it is, because that's what this bill, it's a plan for all of those conditions, they say 1,200, those type of things. That's what the bill is. It's not a plan. But what comes after on that sentence is an aspirational statement that is not this bill. What you're looking for is that would be the next bill that they're going to bring, which says when they talk about the extension, what the plan is, that would be that bill, not this one.
Mr. Davies, please. Voulez-vous répondre à cet commentaire?
Do you wish to respond to that comment, Mr. Garrell? Yes, Mr. Chair. Rapidly, quickly. Keep in mind that at this point, we're focusing on what we have as a legislative bill, C-31, and my colleague sees that quite clearly. Now, the NDP, the Liberals, the Parliamentary Secretary, the Minister of Health have mentioned that we should all work together, work constructively for Quebecers, for Canadians, Mr. Chair. Nothing prevents that. Nothing prevents having the members do their work, having Parliament do its work, that other types of policies be developed that are linked to the topic of this bill. But indeed, what's in here right now is the NDP electoral platform, not what should be in a bill. So simply to ensure that we are rigorous and clear, I think that we really should withdraw these two lines, Mr. Chair, because we're not here to speculate. The preamble is printed to describe as clearly as possible the contents of a bill, and these two lines are not part of the bill.
Well, I have two interventions. One is just like Mr. Vancouver, in terms of costs, I think it's important that we speak accurately. The budget tabled by this government allocated $300 million to cover its dental payment for the fiscal year 2022, 2023, and $600 million for 2023, 2024, for a total of $900 million. The recent Parliamentary Budget Officer just issued a a more refined analysis of that, where he cut that figure to about $703 million. So we probably will be under what the budgeted amount, but really we're talking about between $700 and $900 million is the figure that will pay for the two dental payments, the $650 per child in the two different time periods that can be applied for in the next, I guess, 14 months. Just in terms of Mr. Garon's recent comment, I don't see the word NDP anywhere in the preamble. It says, whereas the Government of Canada recognizes the need to provide interim dental benefits for children under 12 while working towards the development of long-term national dental care program. There is no rule that I'm aware of that doesn't say preambles can't be aspirational, that they can't be descriptive. It's a preamble. You know, if you look at the very first sentence, whereas the cost of dental care services is of particular concern for Canadians, that's a political statement. I mean, there are people probably in this room, probably in the House of Commons, who don't think that dental care services is of particular concern to Canadians. The preamble is, it sets out a particular introduction to the legislation that's going to follow, and I won't belabor this point, but again, given that there's been so much confusion about this bill and what it does, what it doesn't do, it's, I think, imperative that we say this establishes an interim payment and the government is working towards a permanent dental care plan, and that's what the preamble says, and I think we should vote on it. There's obviously other issues that are going to come up in different sections that we can get to, but I think at this point, I just want to say as well, Mr. Chair, that I don't know about the numbering of this, but this is Part 1, Section 2, and it's the preamble. And after this, we get into the short title, number 1, and then number 2, the definitions. Then we get into other sections. So I do think that debate at this point should be restricted to the preamble and the amendment by my colleague. And the other issues that are very legitimate that have been brought up, we certainly will get to when we get to it, but I don't think now is the right time to get to those discussions.
Mr. Doherty?
Thank you, Mr. Chair. Again, I have another question to Ms. Thompson. If a family has insurance, but they max it out, but they are in need of dental care, are they eligible for this?
They're
At
not.
all?
No.
Okay, thank you.
Mr.
With the
Van
NHIB,
Couverton.
they do.
Do you want to continue, Todd?
Just with the NHIB, again, if it's a First Nations family with the NHIB, they are able to top up with that. Correct.
Correct. If they have and they meet, again, bearing you meet all the eligibility criteria, you do have a receipt for out-of-pocket expenses for what they're not covered. Same thing for provincial and territorial programs.
Okay, thank you.
Mr. Van Couverton.
Thank you, Mr. Chair. Sorry, just further to Mr. Davies' intervention, and I would ask if any officials have any corrections about the costing of this program, then I'd welcome your input. The number 10 billion struck a chord, and I just keep coming back to, like, okay, where's the 10 billion? Because I don't see anywhere that we could possibly be spending $10 billion with this. Well, I looked at PBO2, and the legislative costing note said that there was $703 million for one aspect of it, $940 million for the other aspect of it, which adds up to $1.643 billion. It's the same amount of money, approximately. No, total. Over the course of the 3 years that this would be in place, because there's some of 2022, some of all of 2023, and then some of 2024, because it's a 2-year period that would be starting now. It's a one-time payment of $500. But for, like, I suffer from the big numbers problem. That's an enormous amount of money. It sounds extraordinary. In May of 2020, we unanimously passed a $300 top-up to CCB because everybody was in dire straits. It was a really challenging time. A lot of people weren't working, and things were costing a lot of money. And that was more money. That was $1.9 billion. This is an injection of money that is going to support Canadians who need it at a time when they really need it. And it's not $10 billion. So that, if I'm wrong, I would love some clarification.
One on a dental care program, which is more extensive and what you would imagine a dental care program could be. And what just came out is for the benefit. So the benefit is two cycles, two benefit periods, and it is the budget is that government has announced is $938 million.
Thank you. And just to clarify, we're not having any conversations about future and ambiguous dental care provisions, right, tonight?
Nope.
Nope,
On the
thank you.
bill.
That's all I wanted to know.
Dr. Ellis, please.
Thank you, Mr. Chair. And, just to be clear, out of deference to what I'd like to say, I won't talk about the almost $11 billion for the whole program. But that being said, the Deputy Minister of Finance has talked about throwing stones into a lake. And I think we have to really understand here that we have a significant difference with respect to how we should be spending Canadians' money and when we should be spending Canadians' money. The Deputy Minister of Finance would say we're throwing stones into a lake. Well, if you're throwing boulders into a lake, there's a good chance that you're going to actually fill up the lake. And that's really the point here is about how much we're continuing to, how much this government wants to continue to spend, which of course we all know is fueling the inflationary fire as well. So I think that's the real point here. It's about spending, let's spend $1 billion here and $1 billion there, here $1 billion, there $1 billion, everywhere $1 billion. That really doesn't make any sense to me. And those billions add up, and I don't know that there's any billion-dollar money tree that exists out in the backyard behind behind Parliament Hill. So I think that's the difficulty and the perhaps the entrenchment that we see is we have a significant difference how we think we should be, and not just how, but when we should be spending Canadians' money, and I think that's an important thing. And even the Minister of Health alluded to that today, talking about people need to make good decisions about where and when they spend their money and how they spend it, and that's perhaps a significant difficulty. I just want to be clear, and I know this has been a bit belabored, but what we're saying here is that all eligibility requirements with respect to salaries, age, etc., being met, that just to be crystal clear, so that people who have a private plan will never qualify for this money, but people who are covered by their provincial plan and by NIHB benefits will. Do I have that right?
You do. So if you have access to private insurance, this benefit
you're out.
You're out. Well, you're not eligible. If you have access to a public program, and NIHB is considered a public program, because also provincial territorial programs, they're very diverse across the country, and we've been hearing about that today, and with different coverage, different income levels, and different elements that are covered to ensure there's more parity across the board. This would be eligible if there are out-of-pocket expenses.
Okay, thank you for that. And just the final point of clarification is, if I didn't apply for my $650 now, not me, I know that I'm never going to get it. That's perfectly fine. If the person doesn't apply this year, is there a carry-forward provision? I couldn't find that in there anywhere.
There is a provision if
an eligible person.
Eligible person, if they didn't access in the first year because they weren't aware, or they could in year 2 apply for the first year period. That's in clause 7.
Okay, thank you. I just didn't see it. Thank you.
Juste un petit.
Just a little technical matter, Mr. Chair. You know that I'm new to all this. So I beg for your patience. I understand that we are now at 2, then we have already adopted the short title. Could you repeat that, please? Given that we're debating the preamble, which is in Section 2, that means that we've already carried Section 1? No, we haven't yet. We will be doing that at the very end. We'll be voting on the short title at the very end. That's based on the rules of how we go through clause-by-clause consideration. But we will get to it. I just wanted to be sure. Thank you.
That concludes the speakers list for now. Is there any further debate on BQ1? Seeing none, are we ready for the question? Shall Amendment BQ1 carry? All those in favor, raise your right hand. Opposed? It is defeated. So the debate now is on Clause 2, unamended. Any discussion on Clause 2? Are we ready for the question? Oh, sorry. Oh, there is. Oh, there's another. Monsieur Garon, vous avez
Mr. Garrow, you have given notice of a second amendment. Would you like to present it now? Yes, indeed, Mr. Chair. I think that everyone here respects our institutions, the parliamentary institutions, of course, first and foremost. That is, just the way we behave here. And among these institutions is the Parliamentary Budget Officer, who has a role of helping us make decisions that are based on facts, calculations carried out by the competent people, Mr. Chair. We've worked in a very odd context on this bill. As you know, right now we're debating a bill and we're not even in a position to propose amendments or put forward new amendments after seeing and hearing witnesses. The minimum would have been to at least hear witnesses, but something magic happened between Tuesday when we decided on 6 hours of witnesses and today with 0 witnesses. So what we have left is the Parliamentary Budget Officer, who was, well, at least we certainly would have liked to be able to invite them. This has been rushed through so quickly, pushed across the table so quickly with little consideration for parliamentary work, I would say, which is supposed to be so important to all of us, such that the last calculations offered by the Parliamentary Budget Officer, well, we received them last Friday. And last Friday, that was past the deadline for putting in any amendments. So you see, this is, really backwards, putting the cart before the horse. It's, sort of my grandfather would have put it that way. So this is relevant to the amendment that we are putting forward here. The Parliamentary Budget Officer did tell us that a great number of Quebecers are left out of this bill, the calculations in this bill, and I would like to go back to what the Parliamentary Secretary to the Minister said, and I respect them sufficiently to quote them. They said, and I'm sorry, this is just freely translated, we have here an opportunity to contribute, and we need to work together. That's an obligation. So what they're saying is that they're working for all Canadians, not solely for the people of Ontario who elected them, but all Canadians. So among all Canadians, of course, there's a group of Quebecers. Always good to point that out and to keep it in mind. So among those Quebecers, there are 130,000 who will not be covered by this benefit, this dental benefit, a dental care benefit. Why? Well, because Quebec is penalized, because Quebec is already doing well and already working with Quebecers' money. We've made some choices in our society, and we work within the choices we've made. Yes, people pay high taxes, but because of that, we're able to cover a lot of services, including dental care, which, of course, is imperfect, but for children of 10 years of age and younger. So 130,000 people will no longer receive those benefits in Quebec because they will have other public coverage, but they are already paying for those services, you see. So this is a very odd situation, a catch-22, basically. And sometimes people work quickly, try to get things through, do the best they can, and you sort of forget some of the unexpected consequences. Here, the fact that some Quebecers, a good number of them, will be paying twice. This speaks poorly for public services, Mr. Chair. Quebec is, ahead of many others, Nova Scotia as well, a generous program there as well, covering children of 12 and younger. So what's the message that we're sending to the governments of those provinces when we're told, look, it's so important to us to have this Dental Benefit Act, this dental care program, that you will be penalized. You'll be paying twice. So I like things to be consistent and to make sense, Mr. Chair. And I think that the very nature of this bill, because it includes Quebec, because it penalizes Nova Scotians as well, the very nature of this bill is such that it will harm public health care offered by provinces in the future, Mr. Chair. It's well laid out by the parliamentary budget officer. Take two provinces. Well, let's start with Quebec, 130,000 people who will no longer be receiving the benefits. So let's say you're in Nova Scotia. Same thing, similar populations. And in the PBO's document, it's clearly stated that Nova Scotia, due to the fact that it has invested using the tax money from their people and is invested in dental care, and the people of Nova Scotia have decided to pay for that, they will be receiving less. But that their neighbors in New Brunswick, who in their society decided not to invest in such programs, will receive $13,000. And this is thought to, oddly, to be an encouraging way to go about supplying dental care across Canada. But the bill seems to be doing quite the opposite. There is a solution, though. How will the federal government go about making use of public dental care in such a way that, and let me repeat myself, these are provinces that do have infrastructure, are able to provide care quickly, without audits and providing bills and out-of-pocket expense bills and so on, and online to CRA. My colleagues, I certainly hope you don't have to deal with this because it's going to be a mess. We have an automatic payment system already in place in Quebec, so we've worked on these issues. So basically, if you've got a province like that already has a similar aim and is already offering services, we should offer such a province as Quebec, Nova Scotia, an opting out program with a financial contribution compensation equivalent to what it would have received had it not opted out. That's how you really support responsibility and dental care, and to support the responsibility that Quebec has already taken and that Nova Scotia has already taken. And you really, hold that up as a good example. Look, I've checked out all the programs across all the provinces. There are provinces who have indeed decided not to cover dental care, and they'll be repeating that, there's the Healthy Smiles program in Ontario, but that's only for emergencies. That's fine. But there you are, Mr. Chair. You can't have a single measure imposed by a central government like this, covering a number of jurisdictions that already have a number of different types of programs, without at least sitting down ahead of time. That's the least you could do, and correctly listing all the ways the provinces are operating and finding ways to compensate those who will be affected by this central decision. And of course, our colleagues are talking about Healthy Smiles and about provinces who don't have any insurance and how sad that is. They're not talking about Quebec, for example, but it's clear that this link-up between provincial and this new federal approach just isn't carried out, isn't worked out on paper until after the bill has been being pushed through. So you're discouraging the public provision of dental care. So the NDP is discouraging public dental plans, public dental services. I mean, that takes quite an effort. That's not what they're trying to do. And the Liberals are encouraging all this just to stay in power. It's nonsensical. So a solution would be constructive, efficient, and respectful of the provinces, respecting the very principle underlying this bill to the effect that children should receive a certain number of services, and this is the sort of thing that can be negotiated. This type of opting out with financial contribution equivalent to what it would have received had it not opted out, that can be worked out. You can pick a phone up and call Quebec. You can pick a phone up and call Nova Scotia and say, look, improve your program, offer services. That's great. It's important. to us. We care about families, we care about children, and we're offering you compensation, a financial contribution to help you. And I've said this already, the context really counts. That's really core to service. It's not just a partisan issue. It's not a partisan issue at all. Had we done exactly this in the 70s, send checks out to people without discussing this beforehand with the provinces, with Quebec, let's say, just go to some private care provider with the money we're giving you. I mean, good heavens, the NDP wouldn't even exist in Saskatchewan. We wouldn't have any public services in any provinces well funded by the feds. This is really contrary to the very history of the NDP out west in Saskatchewan that inspired all other Canadian provinces, inspired them to create public health services, and we're proud of those. And those services, exactly those services, are provided day in and day out by Quebec, by Nova Scotia, by other provinces. So I call on all my colleagues saying, if dental care counts for you, if a prompt, efficient, well-funded dental service counts for you, for Canadians, then you will unanimously support the Bloc Québécois amendment to the effect that any province that already has a public dental care program for children and that meets aims similar to those of this bill, well, that they will be financially compensated. They will receive a financial contribution equivalent to what they would have received had they not opted out, and will have the option of opting out. And I ask you, therefore, to support the amendment being put forward by the Bloc Québécois, which is favorable to all Canadian children and to dental care in the years to come. Thank you, Mr. Gall.
Part 1 of Bill C-31 enacts the Dental Benefit Act, which provides for the establishment of an application-based interim dental benefit for eligible Canadian children under 12 years old across all provinces and territories. The amendment proposes to add new clause 2.1, which allows provinces to opt out of the dental benefit program and to receive financial compensation for opting out. As a House of Commons Policy and Procedure and Practice 3rd edition states on page 770, an amendment to a bill that was referred to committee after second reading is out of order if it is beyond the scope and principle of the bill. The document further states on page 772, since an amendment may not infringe upon the financial initiative of the Crown, it is inadmissible if it imposes a charge on the public treasury or if it extends the objects or purposes or relaxes the conditions and qualifications specified in the royal recommendation. In the opinion of the Chair, the amendment is contrary to the bill's stated principle of creating a national dental benefit program, since there is no mechanism to allow any province or territory to opt out of the program. In addition, the amendment proposes to alter the terms and conditions for spending provided in the royal recommendation. Therefore, I rule the amendment inadmissible. Oui.
I would like to speak to the decision you have just made, Mr. Chair. Again, I'm reading the short title of the bill, which hasn't much to do with dental care. We're talking about a bill to that's a cost of living relief measure. Now, the First Amendment put forward by the Bloc Québécois was not carried. And right now, I imagine that we're now speaking of dental care, dental benefits. The aim of the program, then, to my mind, and then I'll discuss the matter of your decision.
Mr. Davies?
My point of order is this. You have made a ruling, Mr. Chair, that the proposed amendment is inadmissible. It strikes me that what Mr. Garon is doing, and I was arguing that point, is so I just ask whether or not that's in order.
Monsieur le Président, je peux vous assurer de la pertinence. Un moment, Monsieur Garon.
Just a moment, Mr. Garon.
With you, Mr. Garon, vous avez maintenant vraiment
Mr. Garon, you have one sole option. You cannot debate the decision that has been given. Your option, though, what you can do is to question the decision, and then the committee will decide whether the decision will stand. You can challenge the decision. That's your only option, to challenge my decision. Mr. Davies, though, has a good point. No further debate is permissible. You have only one possibility.
C'est une option que je vais...
Then I will use that possibility. I will challenge your decision and call for a vote.
Chair has been challenged and a vote has been requested. That's a non-debatable motion, and therefore the question for the committee is, shall the ruling of the chair stand? So that's the question. All those in favor of having the ruling of the chair stand, please raise your right hand. All those opposed, the motion is, the ruling of the chair is upheld, and therefore we are now ready to debate Clause 2 unamended. Mr. Davies.
Thank you, Mr. Chair. I have a very, very novel, unusual request here that I'm hoping we can get unanimous consent regardless of what the rules are. And this is with great respect to Mr. Hanley. But under, God, it's hard to see what the numbers are here. Under Section 4 eligibility, 4(1)(d), the last words are plan established by the Government of Canada or of a province. And I think that's just a drafting error, that it should say or territory. And I'm just wondering if I think this committee's worked well on this to make sure that we ensure that territories are included. And so I would just ask that we could have unanimous consent to add that word in both English and French.
Point of order, Mr. Chair. I'm not hearing the translation.
Sit back, Mr. Garon.
Monsieur le Président,
Yes, do you now have
c'est
interpretation?
possible de... Oui, les services d'interprétation sont...
Yes, I have it back. Thank you.
Oui, oui, c'est correct.
Okay, Mr. Davies has posed a question as to the fact that the territories are not included in Section 4 sub 1 sub D, so I'd like to refer the question to the legislative clerks. Oh, it should go to the officials. Okay. So who wants to take that? Ms. Thompson?
I'll ask my legal services to chime in here, but I believe that it does include, the term province does include territories, and that's why it's not explicitly put in this bill, and the Interpretation Act allows for that. So it is included, just not explicit.
Thank you. I'm content with that.
Further interventions in respect of Clause 2. Mr. Shields?
Are we doing Clause 2, subsection 2, definition of adjusted income?
We're doing Clause 2 in total, so if you have a concern over a specific aspect of Clause 2, this is the time to raise it.
Definition of adjusted income? I see what you have listed here and referring to dates, and I understand that adjustment and flexible, but I don't know what the definition is under the Income Act as to adjusted income.
To answer that question.
Thank you, Mr. Chair. Just for the purpose of the Act, adjusted income has the same meaning as in Section 122.6 of the Income Tax Act.
Which is?
Oh,
I can read this.
okay.
Yeah, thanks.
Yeah. So it refers to the total of all amounts of income received for the year for the individual or of the person who was the individual's cohabitating spouse or common law partner, namely family, which is spouse plus spouse partner, income at a specific date based on the composition of the family at that date.
So, in further to that, in the sense that adjusted income, in my simple mind, in the sense of I know what gross income is, what net income is, and dealing with adjusted income, I can deal with adjusted dates in here. Are you talking about income in the adjusted dates?
No, Mr. Chair, if I may, for the vast majority of citizens, the adjusted family net income represents line 23,600 of the tax return. So it's essentially family net income minus any universal child care benefit, the UCCB, and registered disability savings plan, the RDSP income received, plus any amounts that were repaid. The vast majority of citizens, it represents the family net income.
You know, that would have been a lot simpler. We'd all understood it. You put adjusted income. That is something we're not used to reading and saying. So you've put in something here that just is not clear. Net income, people would understand. I'm just saying, bureaucracy, rules, and that one just is not clear. My opinion.
Any further interventions with respect to Clause 2? Dr. Ellis.
Thank you, Chair. And going along with that, is this a term that we can expect to see coming forward in more bills, this adjusted income? Is this something new? Is net income passé now? I'm really unsure as to what the reasoning create a new term is. Is this something we're going to see going forward from the CRA?
Mr. Chair, it's a definition that's used in the Income Tax Act, and as this the Canada Dental benefit is being pursued and it's linked to the Income Tax Act, the same definition applies.
I think we're speaking different languages, but that's okay. Let's speak CRA.
Any further interventions in respect of Clause 2?
I can speak doctor. I don't
Are
speak
we
CRA.
ready for the question?
I bet you can write doctor, too.
I can write doctor, too.
Shall Clause 2 carry? All those in favor of Clause 2? Opposed? It's carried. We're now to Clause 3. And I believe the bloc has an amendment. Monsieur Garand, si vous voulez présenter l'amendement.
Mr. Garand, could you present your amendment? This would be the right time.
Pardon, Monsieur le Président, c'est parce que...
I'm sorry, Mr. Chair. I was just... I just need a moment. I'm really sorry. I've just mixed my sheets up here. Would my colleagues be willing to just give me a moment here? Shall we suspend for a minute? Very well.
Call the meeting back to order. Where we left off, we were considering Clause 3, and Monsieur Garon was contemplating whether to move an amendment. Monsieur Garon, you have the floor.
Yes, thank you, Mr. Chair, for recognizing me, and thank you for being so patient. I thank my colleagues as well. Unfortunately, across a number of versions of the bill, the numbers of the lines weren't written in the same way. So now that I have organized all this, we can discuss my amendment. This bill offers once, on a one-time basis, a rental housing benefit, assistance for paying rent, which is for people found to be a low income, the most vulnerable, for whom rent constitutes an important percentage of their expenses. In a number of provinces, including in Quebec and in Mirabel, there is a real rental crunch, a housing crunch. Some of the citizens in my area were telling me that, yes, it's very nice. You've got a very helpful check, but it's a one-off assistance. And I think that all my colleagues in their various ridings hear about the problems with housing. So this is, a small plaster on a big wound, and that's certainly the case in my riding.
Really some complications with the numbering. Just wondering if we could specify where we're at so we can follow along.
On est à l'amendement BQ.
We're at Amendment BQ3. Yes, I'm aware of that, but what part of the legislation does it refer to of the text? Turn to page 18. Page 18. And the amendment speaks mostly to paragraph G, that the rent represents at least 30% of the adjusted income for the year 2021. So adding that amendment, if we do carry it, and we cut paragraph G, which is my request, then a number of other changes would no longer apply, given that we would be eliminating that part of the calculation. Is this good, Ms. Goodrich? So what I was saying was, housing counts. And the bill, and we applaud this is the part of the bill that I can honestly say I agree most. It's very helpful. It's intended to help people who are in very difficult circumstances. So it's targeted assistance, and I know that a Liberal colleague put this question to the Minister of Health about the virtues of targeted assistance. We are living through an inflation crisis, and we need targeted assistance. The Bloc Québécois has been proposing targeted assistance for a good year now. So once again, there's an attempt to target assistance to households that are in greatest need. The amendment is about how we go about targeting. In order to have a right to the rental housing benefit, you have to meet the eligibility criteria. There's a criteria related to income. Of course, you've got that adjusted income we mentioned earlier. So that's the criteria about income. If you're living alone, you have to make less than $20,000 a year. And of course, that's not very much. You'll agree with me on that, Mr. Chair. And for a couple, $35,000 a year. That's an extra criteria. Then how much the person, as a percentage of their income, has to pay for housing. So we see here at least 30% of income must go to housing. Of course, with such a criteria, you get an unexpected effect. You might have a person who makes $1 more than their neighbor income who will not receive the benefit, and who winds up, someone who gets the benefit will have more money in pocket than someone who lives next door who's got only $1 more than them at the outset. So all this for people who haven't much income in the first place. Why is it that we're leaving people out? Quite candidly, I say, because, Mr. Chair, I certainly hope that we will be able to help people thanks to the amendment I'm proposing, I've put forward. I believe in helping people and that we can help people. In Quebec, we have set up a number of programs which are quite unique to us. Quebec is the only province that has ongoing social housing construction programming. And that's why this was negotiated, the national strategy about housing and so on and so forth, because we had to deal with the fact that Quebec's already moving on that. But anyway, that's not what we're talking about today. In Quebec, we have more people who live than elsewhere in Canada, that is, in two types of housing. Housing co-ops, people who pool their resources, where the rent by regulation is no higher than 30% of people's income to help them. And then there is low-cost housing, often supported by the government of Quebec or by legislation. The requirement is that you can't spend more than 30% of your income on your housing if you're using that type of low-income housing. Why? Because we're trying to help families who really need the help, who are most in need. Because, of course, Mr. Chair, this measure is not to help rich households, a person alone living on $20,000, a couple, $35,000, that's not much. Why has Quebec done this? Because it feels that it has a good model. And I do think it is a good model. It's a model that everyone should emulate, having these ongoing low-cost housing construction projects and so on and so forth. But these people are left out of this bill, this benefit, because they're spending exactly 30% of their revenue on their income, that is, on their housing. So they can't become qualified for this particular benefit. All right, someone less than $20,000 if they're living alone, less than $25,000 if they're a couple. No one here around the table would like to live in such circumstances. It's, already a quite clear criteria which allows us to focus on people who really need that housing benefit. So by withdrawing the section G here, and it's actually a paragraph G, to the effect that it's less than 30% of income, you're going to include more people. It'll be more just, more equal. It's legitimate for any province and for Quebec to invest in social housing, and that's what you say if you withdraw G. And there are different points of view on how to go about it, of course, having heard Minister Hussein, who was here with us today. I think that that's one of the aims, one of the Liberal government's aims here, something the NDP cares about deeply as well, encouraging the construction of low-cost social housing such that we don't leave, 100% or too high a percentage of housing to the private market. And then when it's time to help people like this with a housing benefit, we need to include them as well. Be as inclusive, as fairly inclusive as possible. So that's my hope with this amendment. And I certainly hope that most of my colleagues, I feel that most of my colleagues around the table here, Mr. Chair, will open-mindedly, favorably consider my amendment. Thank you, Mr. Gallon.
Part 2 of Bill C-31 enacts the Rental Housing Benefit Act, which provides for the establishment of a one-time rental housing benefit for eligible persons who have paid rent in 2022 for their principal residence and who apply for the benefit. The amendment proposes to remove the 30% rent-to-income threshold set out in paragraph 4.1g and referred to in subsections 2 to 6. As the House of Commons Procedure and Practice 3rd edition states on page 772, since an amendment may not infringe upon the financial initiative of the Crown, it is inadmissible if it imposes a charge on the public treasury or if it extends the objects or purposes or relaxes the conditions and qualifications specified in the Royal Recommendation. In the opinion of the Chair, the amendment relaxes the eligibility criteria for the rental housing benefit, which would impose a greater charge on the Treasury than is provided for in the bill, since more people could have access to the benefit in question. Therefore, I rule the amendment inadmissible. Monsieur Garon.
I would like to challenge your decision with all due respect, Mr. Chair.
Challenge the Chair. That's a non-debatable motion. The question for the committee is, shall the ruling of the Chair be sustained? All those in favor of sustaining the ruling of the Chair, raise your right hand. 1, 2, 3, 4, 5. All those opposed to sustaining the ruling of the chair, raise your right hand. 1. The chair's ruling is sustained. And so we are now back at clause 3, and I believe there are further amendments to clause 3. Ms. Kwan, do you have an amendment?
I do. Thank you, Mr. Chair. So my first amendment, the intent of this amendment, Mr. Chair, is to stop the reduction of the rent claims to only at 75% of the total payment, and for individuals who pay an unspecified amount for board or other services. This reduction would penalize, in my view, individuals like students, people in supportive housing, seniors who live in these kinds of arrangements. So if the rent is $1,000 and that includes an unspecified amount for utilities, let's say, the amount for rent the applicant can claim would only be $750, for example. And so there are those who are living in a room and board kind of situation, and in that situation, they would not actually have full coverage. So I think that this 25% reduction is steep. So from that perspective, I would like to make an amendment for it to become 90% instead of 75, so that it's only a 10% for room and board for utilities and such.
Okay, I'm going to rule on the admissibility of the amendment. So if it's a point of order, Mr. Doherty, go ahead. But if you want to debate the amendment, can you just wait until I make my ruling?
I was just going to suggest that it's probably not admissible.
Well,
Given the previous, I was not to take away your job there, Mr. Chair, but
Doherty for chair.
I know. I'm trying to help you out, sir.
I can use all the help possible. Mr. Doherty was clairvoyant. Part 2 of Bill C-31 enacts the rental housing benefit, which provides for the establishment of a one-time rental housing benefit for eligible persons who have paid rent in 2022 for their principal residence and who apply for the benefit. The amendment proposes to modify in subsection 4 sub 2 the calculation of the 30% rent to income threshold set out in paragraph 4.1g by increasing the percentage of the payment to be taken into account for rent payments that include board or other services from 75 to 90%. As the House of Commons Procedure and Practice 3rd edition states on page 772, since an amendment may not infringe upon the financial initiative of the Crown, it is inadmissible if it imposes a charge on the public treasury or if it extends the objects or purposes or relaxes the conditions and qualifications specified in the royal recommendation. In the opinion of the Chair, the amendment relaxes the eligibility criteria for the rental housing benefit, which would impose a greater charge on the Treasury than is provided for in the bill, since more people could have access to the benefit in question. Therefore, I rule the amendment inadmissible. Ms. Kwan.
With respect, challenge you. So I challenge the chair on the
There's a
ruling.
motion to challenge the ruling of the chair. That's non-debatable. The question for the committee is, shall the ruling of the chair be sustained? All those in favor of sustaining the ruling of the chair, raise your right hand. 1, 2, 3. All those opposed to sustaining the ruling of the chair, right hand. The chair's ruling is overturned. The debate is on the amendment. Ms. Goodrich.
Thank you, Mr. Chair. I guess we can see the Costly Coalition at work here. But I think this raises a really important question. If we have amendments that we have to submit in advance, and it is worth noting that we had to submit amendments before we even had an opportunity to hear from witnesses, which is highly unusual, and I think goes in contravention of the spirit of our democratic process here and the conventions we've established. But that is an aside. the fact that we submit amendments in advance and you already have a pre-written piece saying that the amendment is not admissible, it baffles me that we even have the opportunity to bring forward an amendment that would be unadmissible based on the Parliamentary Practice and Procedure Manual. This entire system is broken. This is not what Canadians expect when they elect us to come to Parliament and to provide the best possible legislation. This is being rammed through. This is a predetermined outcome. We can already tell. At least I can from my vantage point on this side of the table. It is baffling to me that we are sitting here debating this, and yet a pretty common sense amendment that was brought forward from our colleague, Monsieur Garon, wasn't even allowed to be debated. It was simply ruled out of order. And I think that this just goes to show that this entire process is an absolute sham. If you guys have a predetermined decision as to which ones are going to pass and not, why don't you just give us the green marker as to which ones you're voting on and save us the trouble of having these debates, I guess.
Doherty?
Thank you, Mr. Chair. And look, I can understand that there are people that could really use Mrs. Kwan is suggesting. My concern with this is purely procedural here. The Liberals and the NDP have just committed the government to spending more money without ministerial overview or permission, or was this already predetermined? And if I might ask our witnesses that are here, what does that jump from 75% of the payment to now the approval of 90%? What does that financial figure look like? Because this committee has taken it upon, not this committee, the Liberals and the NDP have just committed a further 15% increase in this perhaps this benefit. And that is a significant cost to the Canadian government that we don't have ministers here to answer that question. Unless this is, again, already the agreement was cooked before we all came and sat here for the last 5 hours or 4 hours. And I'd like to know whether the work has been done behind this, because there is a significant financial cost to the government. And it's going against your ruling and the procedures on House Affairs 772.
Thank you for the question, Mr. Chair. The 75% threshold that was put in the bill is based on the Ontario Energy and Property Tax Credit that has similar features around claiming rent payment. And when it comes to boarding and other services, it does have a threshold of 75%. When it comes to determining some of this data around this particular criteria at the federal level, it's quite limited, I'll be honest, because with Revenue Canada as well as CMHC, we don't have visibility into how many people are claiming such rent and have such arrangement into their rent agreements. But we do know that if you are increasing 75% to 90%, it will increase the number of applicants by default, because you increase the rent payments that are the rent level, which would increase people that are paying over 30% of rental expenses. So by definition, if you're increasing the volume, you're increasing the costs. We don't have the precise number with us right now.
So this hasn't been vetted. It hasn't been accounted for, and we're now signing the government up, or not we, but the members of this committee from the Liberal and NDP have gone against procedures, House procedures, on this, committing the government to further dollars, a financial commitment. This is, Mr. Chair, I would perhaps we need to suspend where you can confer with the legislative clerk or whomever to see if this is even possible.
I don't. This will go back to the House, and it will be for the House to determine what happens next, including the same question on which I just ruled. So this is the final word hasn't been spoken. The House gets a say. Dr. Ellis, please.
Thank you, Mr. Chair. And I guess, oftentimes in committees, we're very concerned about committee time and committee resources and all those things. And I guess I would like to echo my colleagues' comments. If there's, once again, as we saw in other times in this committee, if there's a predetermined route on how we're going to go, we're wasting much committee time here. I was in the SECU committee just before we came here this afternoon. The deaths of 23 Nova Scotians, they were talking about they didn't have enough committee time to even bring the ministers in front of a committee. And here now we have predetermined outcomes already, and my smug colleagues across the way don't want us to continue to have debate, or they want to debate in some sort of sham
Point of order, Mr. Chair.
Slight of way. So from that perspective, I would suggest that
just a second. We have Dr. Ellis. We have a point of order. Go ahead, Mr. Vancouver. You have a point of order?
Name calling is totally unnecessary.
Oh, wow.
Go ahead, Dr.
Thank
Ellis.
you very much. Really appreciate that. That being said, I think that moving on with respect to the serious business that we have in front of us of spending now perhaps more than $1 billion from a ridiculous perspective that we're really unable to even have a debate here, that we're just wasting time in a committee that really doesn't make any sense to me. And then, once again, I mean, here we are. What kind of games is it that we're playing? We have no witnesses for a multi-billion-dollar bill, and we have the inability even to have the rulings of the chair to be respected. Is this really the type of parliamentary committee? I mean, I've said it once before, perhaps I'll say it again, that I thought we had a reasonably functioning committee here, and this is just utter ridiculousness with respect to the ability for this committee to not be able to do its work, that we have legislation now that has a guillotine motion. We have the inability to accept rulings of the chair. We obviously have difficulties in terms of what is right, what is left, what is up, what is down. What are the rules of this committee? I guess that's the question that continues to be played out here. And from my perspective, as I said, if there really is a difficulty with committee time and all we're doing here is wasting committee time, I don't want to do that on behalf of Canadians. I think that we should be cognizant of spending $1 billion that in my mind, $1 billion is a lot of money. And clearly now we're simply adding to the cost of this bill in a willy-nilly fashion with rules that are being challenged here on the floor from one perspective, and from the other perspective, well, no, that's fine, let's go ahead and do it. Wow, is that really what Canadians expect from the Liberals in this committee? Is that what your constituents expect from you? And if it is, it makes no sense to me.
Dr. Pelowski, please.
I clarified it earlier, but if something needs royal recommendation, then however we vote here, it's still going to go back to the House and needs support for the House before it goes into the legislation. Am I not right on that?
That's correct. That's correct. Mr. Vancouverton.
I don't have anything to contribute.
Dr. Hanley.
Thanks. I just wanted to point out a few things. One again, is bringing us back to an affordability crisis. I do believe that there is some urgency to get help to Canadians. We are in a crisis, affordability, and this is an opportunity to work together to move forward. I will point out that there were opportunities for any party to bring amendments to this committee, and I also just want to point out that I think in this case MP Kwan has pointed out an area where there was an extra vulnerability, where by changing the threshold from 75 to 90%, we have an opportunity, again, for that targeted intervention that Canadians need and I think are depending on us. So I support this amendment. Thank you.
Thank you, Dr. Hanley. Ms. Goodrich.
Mr. Chair, tonight is a night that I am thinking about my dad quite a bit, clearly, because I'm going to share another one of the phrases he used to repeat to us all the time, and it was, a lack of planning on your part does not make for an emergency on my part. And I understand the timelines that are related to this bill, but we literally had 11 hours discussing this bill. If this was such a key pinnacle piece of the legislation, the government could have introduced it weeks earlier. It chose not to. It chose to use a guillotine motion. It chose to allow us to have 2 hours of witnesses before the committee to study this. I was just looking up, just for my own interest on this, C11, which was almost verbatim to what it had been in the previous Parliament. So it was studied in the previous Parliament. Parliament fell, got brought back. It was allowed to have 80 witnesses come to committee. I think that perhaps that was a little excess, but we were allowed to have 2, and they were ministers. Frankly speaking, I understand that there is a timeline, but this is a timeline that was fully within the control of the Government of Canada. It was fully within the control of the ministers that brought this legislation forward, and had the government House Leader done his due diligence, he would have brought this legislation forward much earlier. So we would have had an opportunity to actually provide more meaningful contribution and study of this bill rather than be pushed into an absolute corner. So I'm sorry. I think that this entire process highlights that this is broken. We are not even following our own standing orders. This is a sham and an absolute shame.
Mr. Doherty.
Thanks, Mr. Chair. And to Mr. Hanley's comment, look, there, as I said, there's no disputing that. I think that there are people that could probably use that. But we've got 7 people. I've never been part of a committee doing a legislative review where 7 people can commit the government to a substantial amount, not even the minister, a substantial amount of funds. I get that it has to go back to the House, Mr. Pawlowski, or Pawlowski, sorry. You're gonna want to step outside with me at one point, I know it. I apologize. It's crazy that here we are. Cabinet obviously isn't having a say at this. The ministers are not here unless this was, again, as I said, preordained. It's already been put in place, and everybody knows, except for those of us on this side, well, from here down, know what's going on. What a waste of time. You know, we could have, all these people that are here could be at home with their families. Miss Goodrich could be home with her son, and
I could FaceTime him.
You could FaceTime him. But again, I hold out hope that we can have a further debate on, I guess, on Thursday regarding this. And I would ask, Mr. Chair, through you to our witnesses, that prior to the further debate on this, that the departments have done the homework and can provide this committee, the members of this committee, the costs of the bump from from 75 to 90%, so that we can have an educated debate and discussion on this moving forward. I'm blown away that 7 people on a parliamentary committee can commit our government to a substantial amount of money when our colleague from the bloc had reasonable amendments. But for the very same reason, it was voted down. Only because he's not part of the Liberal and NDP coalition. Whichever. So it is going to be costly. I'm trying to take a reasonable approach to this, but clearly reason and common sense is out the door because the deal's done. It's frustrating because we're here to do a job. Canadians send 338 members of parliament to do their job and to ask the hard questions, the tough questions, not to ram things down, not to have a false majority. It really is disappointing.
Monsieur Galland.
Mr. Gall. Well, Mr. Chair, everything here has been decided ahead of time. We know that at the very least, on the Liberal side, they've already been told how they're to vote. It comes from above. We have parliamentarians here, physically in body, but when their hands go up, hands go down, that's decided higher than in this room. Mr. Chair, I would never say anything that we share in camera, but last week, before the cameras, we did agree to hear witnesses for 4 hours. Rather than that, what have we had? 0. Because, witnesses answer questions, right? So, no answer to that. What's gone on between those 2 moments? No right to talk about that. But look, we see that we've had no witnesses. So what was that all about? Right now, we've got an amendment that requires a royal assent, and I'll get to the point of my amendment. You'll see, Mr. Chair, that it certainly relates to what I'm saying right now. The bill, as we have said, and said again and again, is poorly written. It was written up at the very last minute. It's like at the edge of a corner of an envelope, back of an envelope, corner of a napkin. The NDP started whining, the government's no longer supporting us. It's not a dental plan. I understand the NDP. They have a right to fight for what they believe in. That's their right. That said, the outcome, poor work. So, since then, we've adopted the principle of the bill. People who know about this, people who are in co-ops, in housing co-ops, those who work day in and day out with the Quebecers and Canadians who are truly in need, what have they done? They've probably called the NDP to say, look, hey, seriously, you're working for this, and this is the result? This is your coalition? You've forgotten us. You've forgotten the elderly. You've forgotten such and such and such and such and such category. The result? What we're seeing today is a bill. We're changing the rules. There are a bunch of calculations which are too complex, and you can't tell me that the Liberal MPs have suddenly, on their cell phones and so on, and are deciding that they're going to be backing this amendment, voting for it. They've had the amendment for a number of days. The decision is made higher up. They've made no decisions across the table. They're just doing what they're told to do. That's what's going on. But what's most frustrating is the very substance of this amendment. We've got a Liberal MP, Dr. Hanley, whom I have good respect for, of course, who's telling us, well, it takes a royal assent, will be defeating the chair's decision eventually. In any case, your decision, Mr. Chair. And I know that there's an extra vulnerability, says Dr. Henley. And that's why. Mr. Chair, we put forward an amendment. We moved an amendment. We spoke of the number of Quebecers who are being sidelined. 87,000 Quebecers being sidelined. No housing benefit, no extra benefit there. None of them put their hand up then. None of them stood up to defend a Quebecer, put their hand up to defend a Quebecer. None of them defended the housing approach of Quebecers, which allows us to keep more people housed at reasonable prices. Why? Because the Prime Minister's cabinet has said, no, don't support the Bloc Québécois to defend Quebecers, Mr. Chair. And why? Well, it's hard to understand, given that with our amendment, we would have integrated even more people into this overall approach. Of course, this is a one-off assistance. And if you're going to help people, when the parliamentary budget officer tells them, Mr. Chair, that we're leaving a number of vulnerable people outside the purview of this bill, and I'm asking, for a challenge to your decision, none of them look me in the eye. You know why? Because they're probably just embarrassed, and that's bad judgment. Actually, that's good judgment to feel embarrassed for not defending Quebecers. So I support this amendment. Why? Because it does a tiny little bit of the work that our amendment intended. That's all we can do, because probably the NDP has called the government and they have caved in, that's their client, rather than having a universal approach to helping Canadians. That's how we're working, Mr. Chair. When social justice, access to housing is important to us, we're not just serving our own clients, our side of the table. We put our hands out to make real decisions, which will go back to the House thereafter, yes, indeed, that might be supported by the minister, but we put our hands up when we're really trying to help people. And right now, Mr. Chair, of course, all we can do is back this amendment. But it must be heard that this amendment will help fewer people than the amendment that the Bloc put forward, and that no one on the Liberal side put their hands up to support the Bloc. And that's what we dislike. That's what we found deplorable. That's what the Conservatives found deplorable. Despite our ideological differences, we both agree on that. We're in a committee. What for? We have put forward reasonable amendments, which made sense, which supported the foundational aims of this bill, but because they didn't get a word from above, they decided not even to support this, which is in favor of their own bill. So this is all we can do. The client-based approach, the hand-in-hand approach that's going on here on the other side of the table, we wouldn't have had to fall in with this if we'd been able to remove Clause G, been able to delete it. And this is very unfortunate, Mr. Chair.
Well, thank you very much, Mr. Chair. I just want to say, in response to the suggestions of somehow we're not following the rules at this committee with this amendment and with challenging the chair, it's just simply not true. There's a procedure to which we follow, and committee members will vote on it, and then the results will go forward accordingly. In a different committee, I don't normally sit at this committee, so I'm a little bit bewildered as to how normally this committee works. So I don't know if this is how it always works, but in any event, so this is my first time sitting in this committee. But in the committee that I sit on, which is the Immigration Committee, there's been many times when the Conservative members would, in fact, challenge the chair. Sometimes they succeed and sometimes not. But all of that is to say, it is within members' right to do what they wish to do and then follow the procedures accordingly. Nobody's usurping rules here. We're following the rules as they are. And so given that, so the purpose of this amendment, getting back to the issue at hand, is that in my community, in Vancouver East, for example, there are a lot of people who pay room and board. Sometimes they're students, sometimes they're seniors. And sometimes the amount to which they pay is not the 25% as is deemed in this legislation. And, and so what I was attempting to do is to come up with a number that more reflects the actuality of how much they pay. And so that they can have, that more people would in fact qualify. So I would admit that I am trying to get more people to qualify. That is my sin here. and then I'm trying to do that. If the Conservatives don't like that and don't support it, to which that's exactly where they're at, then they're entitled to do that as well and to vote against it accordingly. But to somehow suggest that I am trying to usurp the rules, Mr. Chair, that is just offensive and is also just not true.
Mr. Shields.
Chair, back when we first had a couple of amendments, particularly the second one from the block and the ruling, and I understood what you said in the two rulings, and understood that, but then the ruling on this one, in a sense, when you ruled against it and then they voted for it, really caused me a problem, because in a federation, when I looked at their second one, when they talked about provinces and their objectives, we're in a federation, there's been lots of opportunities, and the daycare was the most recent one that I can remember, where the federal government said we want a daycare program and negotiated that to have the daycare program that they wanted, the $10 myth daycare out there across the country, and they negotiated with the provinces. Carbon tax is another one that you either get in this one, get in the federal one, and they did that. The policing works the same way. You can be in the RCMP or you can be out of it. You can negotiate that with the federal government. There's lots of them out there that are negotiated, but this one, the two, didn't cost any more money. There was no money difference in this one. But the one the Liberals voted for and the NDP this time, it was a money difference. I would understand the first two in the sense of how it went on the vote, why they said, oh yeah, we support that because it's a change of money. No, there wasn't a change of money. It was this one that was a change of money. So the rationale for it didn't make sense of the three. The rationale, and that's where I have a problem with what's going on here, and when I would suggest that this had all been decided, everybody knew what the ruling the chair would be on each one of these ahead of time, and they knew how they were going to vote, either for or against the chair on each one of these before the meeting started. But it still doesn't take away from the rationale makes no sense when we've got the second one in particular, first one I agreed with, but the second one, we're in a federation. And the Liberals, as a party and the things they've been implementing, they've been working with partnerships, like the daycare. This one, they're not. But on the one that you voted to overrule the chair is, you've changed the monetary one on that one. And it's going to go through. We're going to have third reading in the House. You've been around here long enough to know this goes back to the House without asking that. And you'll vote on it. The NDP Liberal bloc will vote together and pass it. You know that. But mine was with the rationale in the sense that it was pre-decided. You knew, I've been around long enough. The chair knows with his rulings. You've seen these before. You've decided, okay, we're going to go this way. We'll vote this one. We'll vote against that one. Which, think about the blocks number 2. And what that means in provinces in the sense of we're in a federation. We're in a federation, and you have just kicked the federation. I'm not talking about Quebec. I'm talking about the other 9 provinces and territories and provinces. You just said that's not important. That fundamentally causes me a problem when we've got a federal government who's willing to not work as a partnership with the provinces, but become dictatorial. That's when you're going to face problems in this country, and you're going to face them from more than one province, because that kind of dictatorial decision-making is not how this federation works. Thank you, Mr. Chair.
Dr. Pelosi, please.
Well, I'd like to respond a bit to that in that there's been a lot of accusations that we're not following the democratic process. The House was elected by all Canadians. It was in the House where all representatives, all the ridings in Canada voted on this. They decided to limit the number of days we had to do this. They're the ones that decided when the amendments had to be in by. It's not up to us, 11 people elected by people in 11 ridings, to make the rules for all of Canada. So this, and really, I mean, you lost your fight over in the House, not here, and we are kind of obliged to follow the rules given to us by the House. That unfortunately, I mean, right or wrongly, that is the democratic process. And as to changing and making amendments that have financial implications, again, that's a matter of, requires royal recommendation, and again, that has to go back to the House. It can't be done by us. So I do believe we are following the democratic process, which certainly isn't unflawed.
Ms. Goodrich?
Thank you, Mr. Chair. And yes, the Costly Coalition in the House joined forces and created a guillotine clause and forced their way through, giving us a set of shackles here at this committee as to how we could proceed. So I think it is very unfair and disingenuous for Dr. Pawlowski to say that it was them. Them is us. We are all members of Parliament that got to vote on that piece of. We can't just pass off all the buck. I'd be curious to know exactly how you voted. Oh wait, I already do know how you voted. So you did vote for that guillotine motion. On this side of the House, this side of the horseshoe, we did not vote for the guillotine motion. But if you're so opposed to it, next time a guillotine motion comes up, you can vote against it. But I do think that and I want to be exceptionally clear that what is being suggested by Ms. Kwan in this, I think it brings up some valid points, and I think there are a lot of misconceptions when someone's rent includes room and board. What exactly is room and board? And room and board is not as defined of how much food it is and what meals it includes as it might have been perhaps 50 years ago. And so I think that the substance of this amendment is actually a valid argument to be having and a worthwhile debate, because I know many people that their rent contract says that they get room and board, and in actuality they might receive a continental breakfast and part of a dinner and no lunch. And so I do believe that there is some conversation that should be had around that. But the fact that we don't know what this cost is going to mean to Canadians, and we're not going to have an opportunity to hear from the Parliamentary Budget Officer to see what the difference of cost is, I think just shows another space where this government would rather work in secret than out in the sunshine. It is said that sunshine is the best disinfectant, and yet this coalition is committed in this bill to removing as much sunshine as humanly possible and allowing this to stay in the shadows and darkness, as we're debating it in darkness at 9:15 at night.
Mr. Doherty.
Mr. Chair, if you will indulge me, I just want to speak to Ms. Kwan's intervention a few minutes ago. Could you please read the standing order 770 on page 772, and then cede the floor back to me so that I could explain what my argument is?
Well, it isn't really the standing orders, but page
Right.
772, the passage that I quoted in my ruling was as follows: since an amendment may not infringe upon the financial initiative of the Crown, it is inadmissible if it imposes a charge on the public treasury, or if it extends the objects or purposes or relaxes the conditions and qualifications specified in the royal recommendation.
Thank you, Mr. Chair. So through you to Ms. Kwan, I was not saying that, Ms. Kwan, through your work, that you are somehow skirting the rules and skirting the issues. Where I took offense to this is that the amendment that you're suggesting will come, and I think I said in my preamble, I'm not doubting that there are people in your riding, in my riding, that could benefit from what you are suggesting. However, I fail to see how 7 members of this committee can commit the government to the financial commitments of what you're suggesting, because there will be considerable, there will be more. You said that the intent was to increase the eligibility. which means more people, and I'm not disputing that there will probably be people that are doing that. I just fail to see how we, as a committee, can do that. It will have to be debated. And so where I had I took offense to it was like the deal was already done. And we just had 3 rulings previously, or 2 at the very least, by Mr. Garone, under the exact same ruling as to why it was ruled inadmissible. And so, we know this is going to pass, or it has already. So we'll have our day on Thursday. Where I took offense to it, again, was not that you did not usurp the rules or bypass the rules, as you suggested. Conservatives are not against people getting benefits. It was the fact that you and your colleagues across the way have rammed this down, and you've committed the government without any discussion, further discussion, and any review as to what that cost is going to be for the government. And I've never seen a piece of legislation like this before where this has taken place in the 7 years I've been a member of Parliament. As a matter of fact, it's always been ruled out, as the chair rightly so ruled it inadmissible, and the challenge would take place, and obviously I think the democracy took place at that time. We're seeing a little bit of a different bent now, and so be it. We'll have our day in the House on Thursday where we'll bring this up, and again, Canadians that are listening I think we'll see that the deal is done, and Mr. Speaker, we've got what 3 pages left to go on this. So, and we already know from this side down that any of the comments that we're going to make are going to be voted against. So I would just say that I'll leave it at this, and it's time to move on because we know that the deal's already done. So,
Dr. Ellis?
Thank you, Chair. And I guess that's the part of democracy is we all get to have our say. There are rules to be followed, understood. I think there's 2 parts. One is transparency, and one is the spirit of the rules. I'll speak to transparency first. And even though we've talked a lot about perhaps 7 people in this room making this decision, we know that that's not necessarily the way it is. Because I don't for one second believe, and no disrespect to many of my colleagues on the other side of the horseshoe, but I don't believe that they dreamt this up and then suddenly said that this is a great thing, and just this evening, wow, we should actually support this, and that's something that I never heard before, and that wow, let's do that, and let's move forward as a group, and let's not even talk about it on our side. Let's just use our telepathy to understand that that's what we should be doing. We all know that is just not true, and that points back to the lack of transparency of the costly coalition as well. That we've heard before in the House of Commons about this great and transparent government and how they were going to very easily be the most transparent government there is in the history of governments in the entire world. And once again, we know that is just not true. That's a falsehood. I will say that because there is no way that this happened this evening. There was no discussion on that side amongst them, and I don't believe for a second they all have telepathy. I don't believe that. I could be wrong, but I don't believe that for 1 second, and I don't think that they share their telepathy with Ms. Kwan. I don't believe that that's true. I'm open to challenge on that. If any of you have telepathy, please let me know, and I would like to speak to you about it, because it would be a neat superpower to have. And so that being said, we know that there's clearly a lack of transparency here. We know that the costly coalition guided by the PMO clearly had input into this, and as my great colleague clearly pointed out, this was a foregone conclusion, and I would suggest that the rest of this is a banana republic that we're looking at, the foolishness coming up next. Please indulge me and prove me to be wrong, and I'll be happy to retract that. That's no issue. The other part that it's related to really is about the spirit or the gestalt of what we're to do here. I realize there's rules. I get it. You know, you like to bend the rules, you like to fiddle with the rules. But clearly the gestalt of the whole thing, the idea, the spirit, is to understand that these rules should be applied justly and fairly and evenly, and that we as parliamentarians have an opportunity to partake in that in good faith and to say, oh yeah, that makes sense. You know what? Okay, well, you know what? I haven't done a clause-by-clause review before when the chair brought forward, out of the big book of words, as we might say, and said, hey, you know what, this is important. We can't be meddling with a bill that the government has set its priority and how much we're going to pay for it, which we already talked about almost ad nauseum. And my colleagues across the way were saying, oh, well, it's not that much money. Well, guess what? If you continue to add to it, your little tiny snowball, as it rolls down the hill, is going to run over your VW Beetle at the bottom that started off as a snowball that you want to throw at each other. And here now we're just continuing to add to it willy-nilly, outside the spirit of everything that we're here to do. And I find that very frustrating. Yes, I understand. Okay, well, you have your say. You can take it back to the House. You can do this. You can do that. That being said, it's outside the spirit of what we're actually called to do here and what regulations, Mr. Chair, exist to guide us in the deliberations that we have. This is an utter travesty. It's a sham. It's a ridiculous, and I think that continuing on with this nature, again, as I said previously, is an utter waste of House time and resources that we continue to want to talk about being held so dear. And I can't believe that my colleagues, with whom we have bargained with in good faith, and I thought we were doing great work in this committee previously, continue to be disappointing in their approach, that obviously there's a scorched earth approach, my way or the highway, whatever euphemism you'd like to use, but that is where we're at in this committee, and that is a shame. It's a darn shame. So we're lacking transparency, we're lacking the spirit of the rules, and when we get to that point, I am unsure how to move back from the precipice that is before us in terms of moving forward as a committee, Mr. Chair, and I think that should weigh heavily upon my colleagues across the other side of the horseshoe. Thank you, Mr. Chair.
Dr. Pelowski.
I don't think we're at a precipice. I think this isn't just a democratic process. This is policy making in general. My administrative law professor in law school, Professor Janish, who I had a lot of respect for, he once said, if you want in on policy making, you have to be in early. Like, don't come once everything's done and want to change things. And I think that's true. And now that this bill has come to us, it's obviously gone through a lot of people, through a whole democratic process already before. And it's hard to stop a train that's going full bore all of a sudden and pull the switch on it. I mean, that's the reality. But I would say, though, in response to, like, where's the democratic process? I would say the democratic process, and where we can add most to the democratic process, is when we're having studies, we're looking into issues, for example, the healthcare shortage, where we're there early, and we're part of the early decision-making process, and we all have input at that point. But I would also say the things you're saying here, and some of the points, and I'm sad to see Mr. Garon is going, but I think what he had to say about why not have a provincial opt-out made some sense to me. And so the democratic process isn't just about this bill, which is already obviously gone way, way down the road, but part of the democratic process is the things you say here don't necessarily fall on deaf ears, pardon me, and perhaps aren't words totally lost, and we're not just wasting our time here, I would suggest.
Ms. Kwan?
Yeah, just a very quick comment through you, Mr. Chair, to Mr. Doherty. It wasn't him who actually said that what I have done is a sham, but rather is his colleague, Ms. Goodrich. So, but notwithstanding, I think that the rules are actually being followed through here by all members, and that...
Mr. Chair, I, in no way, shape, or form said that...
It's not a point of order. You're arguing with the submission. If you put your hand up, you'll get a chance to make a full response. Go ahead, Ms. Kwan.
Thank you very much, Mr. Chair. So I don't want to prolong this debate. Suffice to say, this is a process that's afforded to all members of Parliament at this committee. I follow that process. The matter will be referred to the Speaker to the House, and we'll see how things unfold. And the government, the minister, will have a chance to look at these amendments, and then they will be able to make a determination, which ultimately, for it to go through, Mr. Chair, is that it would require a royal recommendation. So I am hopeful that some of these things can go through, but, Mr. Chair, like so many things of what we do, I still remember back in 2015 when I first came to this House, elected as a member of Parliament, and the first bill, Mr. Chair, was actually on an immigration bill. I never thought in 1,000 years as a opposition member in a majority government that I would be able to move an amendment to a government bill, Bill C6 on immigration, and that's exactly what I was able to do. I was floored. I have then faith in democracy with some hope that in opposition that we can make change, and this is what I'm trying to do here now.
Mr. Doherty and then Ms. Goodrich.
Thank you, Mr. Chair. I won't keep this any longer other than to say your amendment to that bill, Ms. Kwan, probably didn't commit the government to millions upon millions of dollars. It may have, I don't know, but but I'll leave it at that. I think I've been very clear on the record as to where I stand with this. I think it's a reasonable amendment. I just don't believe it's for us to do that. I think it's the minister and cabinet to make those decisions to commit the government. So through you, Mr. Chair, I just want to reiterate with our witnesses here, would they be able to get us the information on any projected increases in this and what the potential cost could be moving from that 50%, 75 to 90%? Thank you. And by what time?
Mr. Chair, thank you for the question. We will get that information by the end of this week. And
if at all possible, Ms. LeBlanc, we're set to start debating this again.
Yes.
I don't have the Thursday. If we could have it be potentially Wednesday night even.
We will commit to have it by Wednesday night. And I just wanted to reiterate that it is a very subset component that we're talking about. And so we do believe that the cost will not be substantial. It will be modest. So I just wanted to point that out. That was not a question posed, but I wanted to clarify. And we will provide that information.
Ms. Goodrich, did you wish to intervene?
Yes, and apologies for my previous point of order. That was actually a point of debate. I was not calling what Ms. Kwan was doing a sham. I was simply stating that the predetermined outcome of the costly coalition between the NDP and the Liberals, who have already determined which amendments they will even allow to have debate and conversation on. This process, this overall bigger level process, is a sham and is broken. And I stand by those statements. I was not referring to the specific amendment or the actions of Ms. Kwan. This is much larger. This is the costly coalition's actions at play here. And I think it's terrifying to me that we are asked to vote on an amendment without having any understanding as to what the costing of this amendment is. I think that it is absolutely inappropriate to ask parliamentarians to just trust that we're going to get numbers by Wednesday night. We as parliamentarians are supposed to do our due diligence. How can we, in a reasonable space, vote for an amendment that we know is going to add cost to the taxpayer, but we don't know how much cost it's going to add? Are we talking about 5 million? Are we talking about 5,000? Or are we talking about 50 million? We have no clue. We can't even get a general estimate, and I don't blame the officials here. That goes beyond what would be expected, because this was an amendment that was out of scope. So I would assume that they probably did not prepare for amendments that were known to be out of scope. And I think this is unfortunate that we're in this position here debating a space on pieces that we just don't have all of the information to be debating.
That exhausts the speakers list. Is there any further debate in connection with NDP number 1? Seeing none, are we ready for the question? NDP number 1, shall it carry? All those in favor of NDP number 1? Opposed? The amendment is carried. Colleagues, bearing in mind that we are not allowed to debate after 12 o'clock, I'd like the direction of the committee on whether this might be a good spot to take a break for 15 minutes. If you're concerned with losing 15 minutes of debate, we can plow on, but if not, how do people feel about taking a break of about 15 minutes now? All right. There's no consensus. We're on to NDP number 2. Ms. Kwan, do you have another amendment in connection with Clause 3?
I do. Thank you very much, Mr. Chair, and I won't hopefully take too long of the committee's time. On this amendment, as the current legislation is written, the legislation assumes that all cohabiting partners had an income and were equally contributing to rent. This, of course, I fear would penalize individuals who were paying larger portions of rent in their circumstances. So, for example, if only one spouse had an income and they were paying 100% of the rent and the other was not, under this provision, they would only be able to claim 50% off their rent. And so I think that it would be better to change the language for it to reflect the actual total amount of rent paid by the applicant. And so therefore, it's actually a reflection of how much they pay as opposed to a decision of a 50% number. So that's what my amendment speaks to, Mr. Chair, and I would move this amendment.
Part 2 of Bill C-31 enacts the Rental Housing Benefit Act, which provides for the establishment of a one-time rental housing benefit for eligible persons who have paid rent in 2022 for the principal residence and who apply for the benefit. The amendment proposes to eliminate in subsection 4 sub 3 the rule that would reduce the amount of rent taken into account in the calculation of the 30% rent-to-income threshold set out in paragraph 4.1g, paid in 2022 by cohabiting spouses or common law partners living separately on the reference day. As has now become common in today's meeting, I am going to cite the House of Commons Procedure and Practice 3rd edition, page 772. Since an amendment may not infringe upon the financial initiative of the Crown, it is inadmissible if it imposes a charge on the public registry or if it extends the objects or purposes or relaxes the conditions and qualifications specified in the Royal Recommendation. In the opinion of the Chair, the amendment relaxes the eligibility criteria for the rental housing benefit in a manner that would result in a greater charge on the Treasury than is provided for in the bill, since more people could have access to the benefit. Therefore, I rule the amendment inadmissible. Ms. Kwan has challenged the Chair. That is a non-debatable motion. The question for the committee is, shall the ruling of the Chair be sustained? All those in favor of sustaining the ruling of the Chair, raise your right hand. 1, 2, 3, 4. All those opposed to sustaining the ruling of the Chair, raise your right hand. The Chair's ruling is not sustained, overturned. Therefore, the debate is now on NDP 3. 2. NDP 2. The debate is on NDP 2.
Mr. Chair?
Mr. Doherty.
I'm going to spare everybody. I think you've heard the arguments that I've had for the last hour on the last one. I'm going to go right directly to our witnesses and ask if they can give us the financial cost, the estimated financial cost for moving this from 50% to 100%, if at all possible, by Wednesday evening. Thank you.
Thank you, Mr. Chair. We will commit to providing, I can answer the question, but we can also commit to providing.
Okay. It would, because it extends the eligibility potentially, doesn't it? Go ahead, sir.
Thank you, Mr. Chair. So in our calculation of the 1.8 million of low-income renters that would be eligible for this program, it does have or includes people that paid their rent. And so that change would not have an impact to the cost unless somebody would indirectly or indirectly falsify their attestation. But that remains a risk to the attestation process.
I think
Dr. Ellis?
Thank you, Chair. And I guess to the witnesses' comments, I mean, this is an absolute unknown. There's no way to understand who's going to say, I paid 63% and you paid 37% of the amount. There's absolutely no way to figure this out. And for our witnesses to say that it's not going to add to it, you have no idea. There's no way to figure that out. I guess you don't. Nobody knows what evil lies in the hearts of men. And when you think of it that way, people can say whatever they want. I realize it's an attestation. I understand that point. Unless I'm missing something here with respect to this amendment. If I am, please enlighten me. I'd love to know.
Mr. Chair, there is a check and balance through upfront validation, as well as through the attestation process, as well as some audit and compliance step to this program. I will pass it over to my colleagues at CRA should we want to hear more around that.
Anything to add from CRA's perspective?
Mr. Chair, sorry, happy to respond to questions specifically regarding validation, but nothing further to add based on the response from my colleague from CMHC.
All right, thank you. Ms. Kwan, please.
Thank you very much, Mr. Chair. I think Ms. LeBlanc actually really spoke to that, because in other parts of the bill, there are provisions to which verification with the attestation process in CRA, random checks or spot checks or however they do the checks, all of those measures are still in place. All this provision that I'm trying to say is that instead of coming up with an arbitrary number of 50%, is for it to reflect the actual amount of rent that people paid. That's all. There's nothing untoward about that. It's just to say that the benefits should reflect what people actually paid. That's it, no secrets.
Thank you, Mr. Chair, and thank you, Ms. Kwan. I think that having an amendment that actually stipulates that you can only get what was paid is a reasonable space to be in, but it comes back to this could potentially change the overall cost to government, and I just wish that we had full financial information that we could be basing our decision off of. While I believe the intent is very clearly good, anytime you're dealing with attestations, you're opening yourself up to some abuse and for some potential where people can fall somewhere in the middle, and that's always a spot that makes me a little bit leery, but I won't belabor that point.
I see no further interventions requested. Therefore, are we ready for the question on NDP 2? Shall NDP 2 carry? All those in favor, raise your right hand. Opposed? NDP 2 is carried. Ms. Kwan, do you have a further amendment to Clause 3 of the bill?
I do. Thank you very much, Mr. Chair. And so my next amendment that I would like to move is to change the application period from 90 days to 120 days. I just fear that 90 days is a very short time frame for people to make an application early. I asked the ministers the minister about the process and what do they intend to do to notify people. I fear, for example, in my riding, and again in Vancouver East, I have a great number of seniors in the riding who are not technology literate necessarily, or even be able to access technology, so they rely on a lot of help from the community and volunteers to help them do all kinds of stuff, including actually getting their taxes and what have you done. I also fear that there are individuals who may have a language barrier in getting the information and then understanding how to go about applying for this benefit. So I think extending the period of time so that it gives people more time to make that application would be beneficial to the community. So to that end, I am making the amendment to change the 90-day period to 120 days, Mr. Chair.
I'm sure everyone here will be pleased to know that the amendment is in order, and the debate is now on the amendment. Dr. Ellis.
Thank you, Chair. I guess the question I would have to the witnesses is obviously every bill has built into it the necessary difficulty that many people won't apply for the benefit. I guess I'm wondering, A, what is that number that would normally be used to understand how many people might not apply for the benefit, whether they don't know about it or they don't care about it, they don't think about it, whatever reason that might be. And of course, adding days to that time will add more people. So again, we are adding potentially to the cost of this bill, and I'm wondering if there's an estimate from our witnesses about that.
Thank you, Mr. Chair, for the question. We are estimating that there will be 95% pickup on this program, and so that is built into our current numbers.
May I continue? Just to be clear, the original estimate for a 90-day period you're saying is 95%. And do you have an estimate that this is going to change that, or is this just something we shouldn't even bother with? If it's not going to change it, why are we amending it?
The extending the period will allow Canadians to get their income tax filing through this period and allow for Canadians to access this program on a longer period of time. Again, there is a 95%, we believe there would be a 95% participation to this program. And our numbers, the 1.8 million includes everybody that would be eligible for this program.
So your cost estimates then were for 100%, if I'm understanding you correctly?
95%.
Yeah, yes. Maybe you're misunderstanding what I'm saying. If we're creating an amendment and we expect it to, where the idea or the spirit behind the amendment is that more people will be able to apply, then does that change your 95% to 95.2, 96.8, 99, 100? Where are we at? And if it doesn't change it, then why are we bothering even making it?
And thank you for the question. I think the 95% was based on the overall population of the 1.8 million. Extending it would allow more people the chance to file their income taxes in due course.
How many more?
I would have to provide this number by Wednesday, if that number is changing.
It's the best we can do.
Yep.
Thank you, sir.
Seeing no further interventions, are we ready for the question? Mr. Doherty.
Mr. Chair, I guess my question to you would be: do you see any infringement on the financial authority of the government through this? If you're going to increase it to rule this inadmissible, I'm again asking for the chair's ruling on that. If it would be inadmissible, because there could potentially be. Again, another financial cost to it.
I don't. If I did, I would have ruled it inadmissible. I don't. Ms. Kwan.
Yeah, maybe I can jump in on that. Based on the answer from Ms. LeBlanc, I think perhaps one assumption that a person could make would be that the government's projection of 95% of the population who qualified would apply within a 90-day period might be a high estimation. it may be that 95% would not make it. And so giving it a 120-day period for people to apply may well mean that 95% of the people would be able to make it. Maybe it'll be 96, I don't know. But hey, you know, but I think it's just, I think the estimation is already a very robust number. And I fear that 90 days means that some of those seniors that I talked about and some of those seniors with language barriers or people with language barriers would not make it into the 95%. That's perhaps the reason why there is little implication in terms of additional cost. Possibly, I don't know.
Mr. Doherty?
Thank you, Ms. Kwan and Mr. Chair. I'm not disagreeing with Ms. Kwan, like in the previous ones. All I am saying is that there should be a financial consideration there, regardless of that this committee cannot impose upon or infringe upon the government. So again, we know that this is going to pass, so we should go to the vote, and we'll have the discussion. Hopefully that the witnesses can provide us with details, on a 90-day and a 120-day. It's the reason why I brought it up when the minister was here. What happens if somebody misses or isn't able to get their application in the 90 days? It makes perfectly good sense in terms of getting your tax return back or filing it and hopefully getting it back in time to be able to apply for this. So.
Dr. Hanley?
Thanks. I don't profess to have technical knowledge on this, but I suspect that the target is the same. The 95% is the same. But as Ms. Kwan says, it allows individuals greater time to get to that same. And if there's an analogy that resonates with Dr. Ellis, I think it would be like vaccine uptake. There's only so many people that will come forward. 5% probably will not, but it gives those individuals more time to get to that goal.
Seeing no further interventions, are we ready for the question? Shall NDP 3 carry? All those in favor of adopting NDP 3 as an amendment, raise your right hand. All those opposed? NDP 3 is carried. Ms. Kwan, do you have a further amendment to Clause 3 of the bill?
I do, Mr. Chair, seeing as I'm on a roll, so let me give this one a try. I asked the minister earlier about potentially extending this program beyond this year in the anticipation that the cost of living is going to continue to increase and people will continue to struggle with their ability to make ends meet. So to that end, the intention of this amendment is to allow the minister to issue another payment after the application period to provide additional support to Canadians who need assistance without going through the legislative process.
Thank you, Ms. Kwan. Part 2 of Bill C-31 enacts the Rental Housing Benefit Act, which provides for the establishment of a one-time rental housing benefit for eligible persons who have paid rent in 2022 for their principal residence and who apply for the benefit. The amendment proposes in Clause 3 to add a new Section 6.1, which would allow for the new rental housing benefit to be paid out in more than 1 year. As House of Commons Procedure and Practice 3rd Edition states on page 770, an amendment to a bill that was referred to committee after second reading is out of order if it is beyond the scope and principle of the bill. The document further states on page 772, since an amendment may not infringe upon the financial initiative of the Crown, it is inadmissible if it imposes a charge on the public treasury or if it extends the objects or purposes or relaxes the conditions and qualifications specified in the royal recommendation. In the opinion of the chair, the amendment goes beyond the scope of the bill, which only provides for a one-time payment of the rental housing benefit. In addition, by providing subsequent payment, the amendment would impose a greater charge on the Treasury Therefore, I rule the amendment inadmissible. Ms. Kwan challenges the chair, so the question for the committee is whether the chair's ruling shall be sustained. All those in favor of sustaining the ruling of the chair, please raise your right hand. Okay, all those opposed to sustaining the ruling, the chair's ruling is sustained. And there, seeing no further amendments to Clause 3, the question is now on Clause 3 as amended by NDP 1, NDP 2, and NDP 3. So the question for the committee is, shall Clause 3 as amended carry? Okay, carried on division. That moves us to Clause 4. Is there any debate on Clause 4? Seeing none, shall Clause 4 carry? Carried on division. Clause 5. Any debate on Clause 5? Shall Clause 5 carry? Clause 5 carries on division. Clause 6. Any debate? Shall Clause 6 carry? Clause 6 is carried on division. That brings us to Clause 7. Any debate on Clause 7? Shall Clause 7 carry? Clause 7 is carried on division. Shall the short title carry? On division. The short title is carried. And shall the title carry? On division, carried on division. Shall the bill as amended carry? Carried on division. Shall the chair report the bill as amended to the House? Carried. Shall the committee order a reprint of the bill as amended for the use of the House at report stage? Carried. Thank you very much, colleagues. Thank you to all of our officials for your patience sitting into the evening, to the legislative clerks and the procedural clerk and the good folks from the Library of Parliament. We very much appreciate you, your service to the committee and your patience sticking it out. Is it the will of the committee to adjourn? We have consensus. The meeting is adjourned.